All right.
Okay.
So can we wait? Because we got to do the minutes, approve the minutes.
Okay.
Then- What did you want to start with?
No.
A prayer?
Should we?
No, yeah, maybe. Well, all right.
Necessary?
No, I'm kidding. Anyway, so thank you for coming, everybody. I'm Barbara Ackerman. I'm Chair of the Commission, and we're delighted to have Scott Hobbs here as our guest. We appreciate you taking the time to come and talk to us about housing. So maybe we ought to just go around the room and introduce ourselves because we have some guests, including our intern back there. Which is fun. Peter, you want to start?
Peter Campbell, committee member for a couple of years, became president, obviously.
Russ Barksdale, been in New Canaan 7.5 years now, seems a lot longer.
Scott Hobbs, been in Canada for a very long time.
What are you, third generation?
We're raising the 5th generation.
Oh, my
So my
God.
great grandmother was here too, so.
Wow.
Very nice.
Wow.
Shannon Valerie, Health Department. I've been working here 6 years.
Marcy Rand, Director of Human Services.
Raquel Harrison, been in New Canaan 11 years, been on the commission for about a year.
And your intern?
Miss Kim.
Hi, I'm Chrissy Gabriel, senior at New Canaan High School. Awesome doing next year.
Awesome.
And we have up on the screen,
John
John
Knight
Knight.
from the
And Kim,
commission.
thank you for joining us, Kim. We appreciate
My name is Kim Morton. I'm the co-chair of Health and Human Services for Town Council. So I just want you to know that we're all here if you need anything. So thank you for having me.
Thank you. All right, so first order of business is to, sorry, Jen. Can't see you.
Top deliver.
No, you're the best. You're the secretary. You're the most important.
I'm Jen Laddick. I've been on the commission for a couple of years. I've been in New Canaan for 18 years.
Oh, my
I
gosh.
believe I can say that.
Yeah.
I'm an old timer now.
Not really.
Not compared to Scott.
Yeah, true. Okay, well, thank you. Just, I guess, yes, now the first order of business is to approve the minutes from the May 1st, 2025 meeting. Do I have a motion? Any?
I can start that.
Okay, should have asked, no changes or anything? All right, all in favor? Thank you, okay. And now we'll turn it over to the Health Department. I just want to say Shannon's here, Deborah was just here, and Ellen and Gino, you guys have just done an amazing job of, during the transition, and I know we're welcoming Amy Lahaney on Monday, which
Yeah.
I'm sure you're looking forward to.
Really
You've had a
looking
chance to
forward-
meet her, right? And
Yeah, I've been talking with her too.
good, good. Well, we really appreciate what you all have done, just kind of filling in and, it's always a challenge. And
Yeah.
just very grateful for that.
Would you guys like me to go through the report real quick?
Sure.
Okay. So I won't go through every painstaking one of these, but I'll point out a few. Obviously, it's pool time, so we're doing public pool inspections. That's primarily Gino. We had an uptick in our building permits and COs that we had to review and approve. The housing and nuisance complaints investigated were primarily garbage this time. It's an
Oh.
ongoing issue. We have had 53 ticks that we submitted to the state of Connecticut's laboratory. We actually had a lot more ticks come into the health department, but what I do first is identify the tick. And if I'm not confident what species it is, then I will send it off to the lab. Or if I am confident it is a deer tick, we will then send it off to lab. The lab only tests deer ticks. It does not test other types of ticks at the moment. Of those 53, we didn't get all the results back yet. Only 17 results came back. 5 of those came back positive for Lyme disease. One of them came back positive for a co-infection of Lyme and babiosis. The others were identified as maybe an American dog tick or a Lone Star tick and weren't necessarily tested. So we're still waiting on quite a bit of results of the 53. I talked to the state lab and they're kind of inundated with ticks because of the influx this year. So I'm really trying to do my best to not send every little thing to them.
Mm-hmm.
And then next is our community health numbers.
Can I ask you a question about the
Yeah.
ticks? Is this different than last year? Is this
Yes.
kind of normal for this time of year?
So it's definitely normal to see more ticks this time of year, but I can't speak to if it's alarming or not, but we have seen a lot more ticks.
Yeah.
I'm attributing that to the fact that we're just not getting colder winters, so the bacteria in the soil isn't really dying off, and then the ticks aren't really dying off either. I did notice a lot of adult ticks early on in the season, like you usually see like larvae and nymphs. And I was just like, right in March, I was seeing like full-blown adult ticks. So that was interesting. Gives them more time to
And I think
reproduce.
if you look at that,
Yeah.
I think the Lyme infection rate seems a little high to me, right? You said 5 out of 17.
Well, it's tough because I would like to get more, I would really like to know the accuracy of the tick testing because it's a little convoluted, but it's hard because when someone comes in and they have a tick bite on them, we can't assume that was the only tick that bit them because usually they can be in a nested area or something like that. So yeah, we got 5 positives in the month of May, basically.
And I don't want to belabor the point, but do you also ask them if they have a bullet anywhere or any other?
Yeah, so I'm not a medical professional, so I do try to steer away from diagnosing
Yeah.
a rash or anything like that, but I always give everyone information
Okay,
on
good.
protocols. And I work very closely with our medical director. Most primary care physicians are in this area are pretty familiarized with Lyme disease just because of the area they're in. So she has quite a bit of experience with that.
Jamie Liskowski.
Dr. Riskowski, yeah.
And you know, you can identify different types of ticks.
Unfortunately, yeah. That's very impressive. But if I'm not like 100% sure what it is, I just send it off
I'm like
to the lab.
80%
It's a
sure.
great resume
Amazing.
builder.
Yeah.
It's a great resume.
Yeah,
Sorry.
love that.
One other question. Are you also confirming that people haven't traveled when you're sending these? So we know
Mhm.
they're New Canaan's specific?
Yeah, so that's actually one of the questionnaires on the
Okay.
form is where they think they acquired the tick. I mean, you can never be sure, but I usually am like, were you out of the Northeast at all? No one has been so far.
Okay.
It's all been in New
Yeah,
Canaan.
it's all been in New Canaan.
Yeah, yes. Any other tick questions? We are going to do, I do frequent tick educational talks, but we're trying to do a bigger one and hit not just the 65 and older population, but try to get parents. It's going to be June 17th at Waveney House, probably at 11 a.m. I'm working to get a registration link and start advertisement for that. And I'm going to be partnering, Dr. Riskowski is going to join me for the talk. And we'll do it together. We've done them plenty of times before, but trying to do it at Waveney so I could get, quite a bit of people. And then for the rest of our community health members, it was a slow month just because of everything going on. But we did partner with Elite Dermatology in town to do a first responder skin cancer screening since they're most at risk. And, I saw some New Canaan firemen there, which was great, and firewomen. Ellen did quite a bit of private health consultations. She did 10, which I'm excited about. And then our upcoming events is we're going to be doing 2 health talks, one at Schoolhouse, one at the Lapham Center. We're doing an EpiPen training at the Silvermine Arts Center. And then again, that tick-borne illness talk we're doing at Waveney. Ellen and I also attended another suicide prevention conference. We went to a specific breakout for safe messaging for suicide, which was actually extremely helpful. So it's like how to address the public about suicide and how to use certain types of wording. Gino and I also attended the lead risk assessor training. It's something we have to do every year, where you take an exam at the end. We're good. We're still lead risk assessors. And Lahaney starts June 9th.
Very exciting.
Yes, very exciting. Okay, and I think that's it. If you guys have any questions,
That's like the Shannon.
thank you. Marcy?
My turn?
Sarah Marcy.
All right, I'm not going to go through like all 4 pages that I sent you guys. But as far as fourth quarter clients, my numbers have gone up. I went from 237 to 242. Jackie's has gone up a little bit. She has 165 families consisting of 170 children. No domestic violence cases in May, which is nice to hear. As far as financial assistance, we have partnered with Zoombox and Caffeine and Carburetors to do our automotive assistance program. And to date, we have, well, the fund has spent $232,323. Sorry,
No, that's
it's
okay.
2323. I'm like, what? I'm not a numbers person. $2,323 on automotive repairs, and we have a line of people.
What's the process?
It's actually, they will do a financial assessment with us if they are not clients of ours. If they are, they have already done a financial assistance. I will contact Sean at CNH, and then he will contact the client. And then usually they will go out to the house just to see what's going on and assess the car there. Because a lot of times it's just, spark plugs or something simple like that. If it's something bigger, they will bring it into the shop. And then they invoice us, and we contact Meg Soffin at the Community Foundation and get it paid. So yeah, that's where the money is being.
They're watching it, yeah.
Yeah. So that's really exciting. The people who are getting repairs done, some of them are like new tires, and they're really trying to focus on safety. We have gotten, Sean's funny. He said, he'll go and take a look at the car, and in the front seat, there's a list of like, the sunroof doesn't open. And he's like, I would love to fix all these things, but I want to be road, where this fund is for road safe, duct tape the sunroof, because you just have to get to work safely. So that is it, but it's exciting. The vulnerable population list is about the same. That I think I may ask you to put out again, just to remind people that we have one. It hasn't been really put out there. It's on our website, but I may ask if you could just do like a blast that we do have a vulnerable population list. And if anyone wants.
More people.
Yeah, exactly. Energy assistance, so far we have done 77 applications totaling almost $25,000. Renters rebate, it started in April. I've had 21 applications, that's totaled about $8,000 in rent rebate. My programs, the Life Reimagined and the Waveney Grief Group, are both being highly attended and consistently attended. So that's fantastic. And last but not least, I think it's next week. It's a 3-day program. I'm going to be certified as a mental health first aid instructor.
Oh, wow.
So that's going to be really great for the town, because once I am an instructor, I can do like courses in at Waveney. I can do a course at the library here, especially in town hall. Everyone who's employed in public service should really have like a small snippet of like what it is and what mental health looks like.
So is that being sponsored by the state or?
No, that's a program that is like, it's a national program
Oh.
and it's a paid for program. So
Oh, yeah. sure.
Yeah.
It's great. Where is it?
it's online, which is actually
Oh,
kind of nice.
yeah.
Yeah, I don't have to go anywhere. And and I may recruit Shannon to
Oh, wow.
help me with the class.
We'll be buddies.
We'll discuss.
Hi, Tom. Welcome.
Sorry, I'm a little numb on half my mouth.
Oh, and you missed
But,
all the important stuff. Shannon's gonna start again.
No. It's good. On the grief groups, is there more demand than, do we actually need more of those?
You know what? No, and I I have my short-term, speaking of short-term memory, I have to like
I
really
have a
start working.
Spot for you.
Yeah.
No problem.
Who is the spiritual, the,
Daniel? Was
no,
it Daniel?
no, the
Okay,
woman who
the new
is that
one?
Waveney? Yes. Oh, good.
Uh,
That makes me feel better. Is it Tracy?
It was
Stacy?
Stacy, probably.
Stacy.
Okay.
She sat in on our group and she said she wants to create one on a Monday evening. So, you know, I think like right now we're good. Mine is going to be like, mine's an ongoing group. It's not a fixed time. I kind of felt like the fixed time made people have like homework and they had to like get better in 12 weeks. And that's not, it's not linear like that. So, you know, I think when people start to feel better, they'll fly the nest and then, you know, new people will come in. And there was a concern in the beginning that the new people would definitely feel like new, but you know, grief is so, it's just, it's such a strong feeling that everyone is so accepting of each other, you know, so the new people don't feel like new. They are like accepted right away and they're met where they are.
But
So
we have enough resources.
currently we do, yeah.
Well, they can always pull. I mean, we've added pastoral care.
Yes.
So we've added people to the pastoral care team and also to the pastoral team on the hospice side of it, to just augment whatever you need.
Yeah,
You know,
thank you.
we'll be there for you. So.
Well, and I said
it's
the
a
same
huge-
thing to
It's a growing
Stacy,
need.
yeah,
It's a growing
because
need.
she said she had never done one alone, that she had always done it with somebody else. And so I told her that I would, if she ever needed me.
Would this also, this is typically when somebody loses a partner or spouse or somebody.
Mine is for a spouse, yes.
But if somebody has a spouse who may be alive, but who is incapacitated or has dementia or other issues that's
That would be a
just as
caregiver support
grief
group.
causing.
So we have that
That's a
through our
caregiver support,
Navigator
yeah.
program, and we have social workers that serve on that as well as nurses. So just for the caregiver. So
Right.
if you're a caregiver at home and your loved one is suffering from anything, then
Yeah.
we have those social workers.
And other agencies do as well, like
Okay.
The Alzheimer's Association.
Yeah.
Yeah.
Bridges, is that what it is? Yeah, the one.
Yeah.
I'm just thinking of our mental health, senior mental health. This is a big part of.
Yeah.
mental health
It's funny, you know, it's
seniors
funny
is
though,
the
like it
grief of
really
aging.
depends on when someone wants to like enter that like grief process.
Mhm.
So a couple of the people who attend came like literally a month after their spouse died. I have a couple people who have started a year and a half after their spouse died. It's really like such a painful process that you have to go through that like there are some people who are just not capable of like getting it done yet. I mean, unfortunately, you can't get under it and you can't go through it and you can't like jump over it. You have to like process it, but some people will like avoid and, you know, pay taxes and get paperwork done and pretend that they're super busy until they finally decide like, I've got to like think about this and process it. So it really depends on when they're ready to
Thank you.
talk
Well, it
about
sounds like it's a great resource.
it. Yeah, it really,
Yeah.
I'm thrilled with how it's taken off. And thank you for always giving us a
No,
space.
you guys, great partners.
Do you want to talk about gift cards?
Do I want to? Yes, I do. So we have our back to school program coming up. And unfortunately, like our donation button isn't as popular as like I was hoping, but everyone is saying, you know, it's like a crazy time of year right now. And once school has ended, we are going to request that get put on Instagram and stuff and remind people, because I know it's graduation, it's prom. I wouldn't give to anything during.
Nobody's thinking about back to school.
No one
right
is
now, but
thinking
you
about
need that.
that.
You need those
But
those
we
money in
definitely,
July or
yes,
August, right? Yeah.
yes, because we start giving our gift cards in August, so the families can get like all the notebooks and
supplies.
school supplies and all
Yeah.
that kind of stuff. So we are going to put the word out as soon
Good.
as school is over that we
I think the
need.
Sentinel did a nice job and a
Yeah.
nice
Yeah.
piece on it. I think
Yeah.
I think they'll continue doing that.
We
if
just
you
have to keep
asking them.
talking it up.
And just keep
Yeah.
talking it up.
Mike Dinan said he would run something.
Yes, he did. Yeah, Barb
So
and
that's
I.
good. Yeah, we
We cornered him in a hallway.
office. Yeah.
Um,
Mike, don't you want to do this?
And yeah, he did
He's
say
been
he
very
would
open
do
to it.
it.
Yeah. The only thing is
Thank you.
do you want to talk about agency evaluations?
So, yes, Our agency evaluations, we are going to work on, well, I'm going to work on sort of narrowing it down because we want to be as concise as we can when it comes to budget time, right? So when these outside agencies ask for money, we really need to know, we know all the wonderful things that they're all doing. Like none of us will discount anything that they're doing because like they're all wonderful organizations, but there are some organizations that like do have money that is being managed and may not need it as much as other agencies. And I'm not sure we've like dived down.
We talked about
into
like
that.
an evaluation form that would be across every agency. It would
Right.
be like a one-page
A one,
summary.
everyone will have the same evaluation.
Yeah,
and
this is your
ask
homework
all-
for the summer.
Right, well, we gotta like, and we'll all ask the same questions to all the same,
Yeah.
to all our agencies. And it's really like, we want to know like fiscally, how healthy are you? What exactly are you giving to? Because I think it's really important that like, we know that the money, although we're not giving like hundreds of thousands, but like the money that we're giving is really being given to a program that really needs it. And I think that we need to be cognizant of that. So we're going to narrow down. It's going to be like a one pager and we're just going to get,
And
you
you,
know,
maybe,
into the
we were
guts of
saying
it.
maybe the liaisons could help with that,
Yes.
putting that information
Yeah, that would be
together.
great. So if
Yeah.
anyone has like some good questions or, you know, things that they think should be on this questionnaire, just email them to me and I'll.
I just, I think one of the things we should look at is, I think the budget now is signed, right, for the state. It is going to have an impact on Medicaid, people coming off of Medicaid. That's been estimated about a reduction of about 150,000 people. 25% of people in Connecticut are on Husky. It's
Mhm.
that high of a number, and another 5% are uninsured. So I know we think that, you know, New Canaanites are all wealthy, all well-to-do and everything. We still have a population that are living, you know, paycheck to paycheck and whatever. It is going to have an impact on people. We're starting to see, you know, calls come in and people being concerned about losing their Medicaid coverage, joining the ranks of being uninsured, and then having to
Yeah.
reach out to you good.
And
people in the
unfortunately,
town,
we
whatever.
don't know exactly what that is yet. You know, I got an email from Claire Belen from their Choices, and that was really like, we don't know exactly what this is going to look like yet. So like, when we do get those calls, it's very hard to say.
I'm just gonna let you know
Yeah.
that the wave is coming and
Yeah.
and we, you know, we're keeping track of the analysis that's being done for the
Yeah.
state, and it is substantial,
Yeah.
so.
That could really impact.
It will.
everybody.
Well, it's
Yeah.
gonna impact everybody,
Yeah.
right?
Sure.
Any healthcare provider, but also people that are looking for care and services or
Absolutely.
free care and services, that's gonna go up dramatically.
Do you say anything, Peter?
No, I think planning ahead, because it's not certain, the budget bill, but a lot of people are betting it's not gonna break the right way on Medicaid, so just be in dialogue with other folks around. And the other thing, you know, the world does keep intruding from a health perspective. I think we'd be interested in seeing reaction to new vaccine guidelines that are starting to come out. Certainly, think about how you guys would want to communicate, especially as you get into the fall where it gets heavy, because there's sort of mixed messaging coming out right now, and I'd love to know what your perspectives are and what guidance you want to be providing for the town as there's more clarity, you know, in the next couple of months. So maybe we can pick that up in September.
Yeah, it's a great idea. Okay, anybody use this?
Start typing it out.
Leave it on a car seat.
I saw that 22 people applied for the job
Yeah,
and they
There's a
interviewed
lot.
3.
They interviewed 3.
And they found her, which is, but
Yeah.
pretty impressive.
And actually, I should have noted, so for the influenza vaccines this year, what we're going to do is actually work with Human Services. We're going to probably contract.
I think it's going to be, I think we're contracting with Walgreens
Walgreens for the employee
for the employee.
health fair for Town of New Canaan employees. And then for residents, because it's so accessible at pharmacies, I think we're just going to focus on vulnerable people and homebound. So we're just going to be purchasing the high dose influenza vaccines for people that cannot get out of their house, but they have people coming in and taking care of them. So that's what we're going to do this year, because we're doing it at Lapham, which is great. But if someone can go get to Lapham, they can probably get to Walgreens was my idea about it. And I did run that by Amy, not just.
And Walgreens will be, Walgreens will be actually coming to our employee health, is it called the health fair?
Yeah, it's October
Wellness fair.
25th.
Oh, where are you doing that?
That will
Waveney.
be here, right?
Oh, I thought it was at Waveney House.
Is it at Waveney?
Yeah.
See how much I know?
Maybe not. I don't know.
What's a ways away?
We're gonna talk.
You want
I
a central
promise.
place. It's good to have a central
We
place.
will have it under control.
Yeah.
Right?
Yeah, it's under control.
We're good.
All right, does anybody have any other questions for Marcy? And I think
Please don't.
Peter offered to give
Not
us
me
an
today.
update on Silver Hill.
Yeah, so there's a bunch of things happening. It's now called the assessment program at Silver Hill, TAP. Some marketing opportunities there, but notice that New Canaan's not in the title of it anymore.
Mhm.
And that's mostly a recognition that Westport is now fully in. And you think about 5 slots per week, they're basically signing up for one of those. So it's a big accomplishment for all the folks who worked on that. So it's Westport, Wilton, and us, and they're going to be making a meaningful financial contribution as well, which is really, really great.
Can I ask you a quick question about that? Is the Board of Ed also, the Board of Ed is also contributing to the assessment? Do you know?
In New Canaan?
Yeah.
Yes.
Okay.
Yeah.
I don't know that. That's
I mean, there'll be a probably rich financial discussion, in the fall, given the evolution of the program. The other thing I'd mention is there is an uptick, and that for this year of the program, the older adults are now 18%. And that's up from kind of low teens, which had been for a long time. So I think for the senior group, that's a real shift.
Yeah.
Because I think it was like 11% or something.
It's been something, and because they've been reporting that basically since inception, and they finally carved out this year, and it's up. And I think that's really positive.
Well, I mean, the New Canaan is aging, over 70 population, we're approaching 14% of our total population, so that brings into, as we have a subcommittee for, that brings into other
Yeah.
health issues, and mental health is certainly in that group.
And maybe it suggests that there's not as much of a stigma too. Maybe, they're being more
No, it's good.
willing to participate.
And the last thing I mentioned, they're reporting now that they're starting to emphasize a little more, not just the assessment, but they're calling sort of the hand holding through the handoff. Usually that doesn't happen just like that. Sometimes the compliance isn't very good, and they realize they need to stay engaged with whoever's come in a little longer to make sure they get with the right person. And if it's not working, so they're evolving the model a little bit, where the moment of care is not just the assessment, it's as they get integrated into a different kind of therapeutic modality. So I think it's,
That
again,
sounds good.
it's really good learning. I mean, this is they keep on improving, and I'm really impressed by how they keep learning and evolving the model. So it's generally a really good report from the program.
Right. Well, thank you. Okay, so we have our commission activity we're moving on to, and the first thing we're going to do is appoint a commission priorities committee, sorry. Based on, we've had a lot of discussions about what is our purpose and how can we be as most effective as a commission. And we also then had, I think, a really robust discussion after the health well-being survey results came out about, if that defines kind of more what we should do. And so Peter's very generously offered to chair an effort to really put on paper what we think, as what the mission of the commission is, and what the best thing that we can do in terms of priorities and where we put our efforts. So thank you for that. And thank you to Russ, Raquel, and Jen for agreeing to be on it. So I'm just gonna move that we appoint a commission priorities committee consisting of Peter Campbell as chairman and Russ Barksdale, Raquel Harrison, and Jen Laddick as members. So we want to talk, anybody have any discussion about that before we? I think it'll be good to kind of get some resolution there and, you know, have something that we can all say, okay, this is who we are. And so we can talk about other things. So,
Wrap up a 2-year discussion.
yes, yeah, exactly. But anyway, so, I have a motion on the table. Do I have a second? Thank you. All in favor? All right, thank you. Well, we look forward to seeing, you know, your results or your recommendations. And then the last thing is just Tom, when you give us I guess you met on Monday, the Seniors Behavioral Health
Meeting
Committee.
of our old subcommittee, John and Alyssa, not here, I guess.
No,
And Jim and our consultant, Nina Mama. And Nina wrote a further detailed analysis of the senior part of the behavioral health survey.
Mhm.
And I mean, the headlines, well, first, that the seniors as a group are a little happier with their lives than the sort of 30 to 59 group, which is dealing with more challenges of children and older parents. Getting, making an income and supporting their house, et cetera.
yeah.
Oh, thanks, Russ. But notably, the 60 to 69 group had a lot higher level of issues, concerns than the older adults. And so that's kind of notable and worth further study. So the group would like to do some focus groups to get a little more understanding of the details of what's going on. And the idea is to have 4 focus groups stratified by age, 2 groups in the 60s, the 70s, and the 80s. And there was some discussion whether we want to do men and women separate or together,
Interesting.
but I'm not sure about that. And Nina is a experienced focus group leader. She would do a good job.
Oh, good.
So the challenge is, how do we recruit people that are willing to do it? And it would take maybe an hour of somebody's time. They maybe meet here in a conference room. Would be all confidential, and so.
Yeah, we did that before when we were looking at telehealth for seniors, and it was a little challenging to get people to come in, but mostly the 70 or 80-year-olds
Yeah,
mostly.
so if you have ideas or know, some of us know a lot of people
You know
in those
people.
age brackets. So
Yeah, so we'll.
Yeah,
have her-
Jim Lisher, yeah, is me and Marcy think we can get a good amount of people.
Oh, great.
Yeah.
In all age groups or?
Yeah, well, I suggested also that, I don't know who's gonna be like willing to do like
Right.
RSVP kind of thing, but like if we put up flyers at Millport and Canaan Parish and Schoolhouse, and kind of if you feed them, they will come. So like maybe if we serve,
Yeah,
like pizza and
Yeah,
and ask for an hour of their time and do like, because the 60 to 69 is a funny age group, right? Like
Right.
some are retired, some are not. So like if we do like a 7 to 8:30, you know, that age group should be able to come. And I think between Shannon and I, we have slightly different populations, like different socioeconomic areas and stuff. So I think that we should be
great.
able to get like a
yeah,
good.
and even like what I do with my talks, you just have to do it frequently, and you don't always get a massive amount of people, but if you just offer it frequently, you wind up hitting everyone you want to hit. So that's my only suggestion.
No, that's
is
great.
just doing more options for the breakout groups on
Mm-hmm.
time.
The other one I had is, Meals on Wheels does, for the people that are home isolated. Maybe you may not get them here without sending, Get About or someone else to them to help them get here. But putting a survey in there, and next time they pick up their meal, they take that survey from them, give them a chance to fill it out. That may be a way of reaching those people that are, not on the men's group or in active groups and committees who are not as, independent.
Engaged, yeah.
Who are more isolated, socially isolated or home alone. And certainly those are people that we want to make sure that we're servicing too.
Well, that's another great idea.
Great idea. John, do you have anything to add since you were at the meeting?
No, I think Tom did a good job of summarizing it.
Of course he did. I just thought maybe. Okay.
The only other thing I might add too is, and you kind of touched on it, Marcy, but that idea of rather than necessarily being strict about age, trying to cohort people by life stage. So if it's retirees or, you know,
Sure.
That's a good
independent
idea.
living versus somewhere else, it just might be, it might allow you to pull on different push
Yeah.
points.
Yeah. Well, that was an
There's a big-
interesting.
There's a big difference between somebody who's 68 and working and needs to
100%.
work, and somebody who's playing golf.
Right.
There's gonna be.
Right.
Right.
Or whether they can even go to the YMCA. I mean, we always,
Yeah.
in the emergency department, once you hit 65, it's all about quality of life. The numbers don't matter anymore, right? I think it's, once you hit 80, if you hit 80, you have the same chance of mortality every single year
Uh-huh.
than you do, you know, when you're 90. That number doesn't change every year. It's the same mortality rate because you've reached that threshold, right? And so
Okay.
it's a little bit of like thinking more life stage rather than age.
Look, we all know people that are in their 90s that are very independent, are still
right,
working
right.
in their own business, doing whatever. And we also 90s that are homebound or in an institutional setting or something. So
It's a very,
once you get to that, as you said, once you get to that plateau, then, you know, it's more infinite kind of
Yeah.
smaller incremental changes that you see as compared to getting from 60 to 80.
right.
Yeah.
Or they end up being big life health events,
Sure.
right?
The
That
fall.
change
Life
trajectory,
changing,
right?
Yeah. Excellent points. I hope that helped.
Thanks,
So-
great.
Yeah, thank you for sharing that article too, Raquel, about the relationship between seniors and teens and how important. it can be.
Yeah.
That's really interesting. Jen, do you have anything to say? You get to be busy
No,
taking
I'm
notes.
so sorry. This
I
is
know.
also interesting.
Okay, good. Okay, so now we'll move on to our featured speaker.
Oh,
Scott, thank you so much for coming. And
Okay.
Scott, as everyone knows, is chair of the New Canaan Housing Authority and raising a fifth generation of Hobbses in town and doing so many wonderful things for the community, not only from your business, but also personally. So we're very grateful for you to come here and talk with us about housing and help us understand some of the different.
Sure. Don't know if you guys have any, general questions to begin with, or just any topics in particular you'd like to hear about. I can speak on.
Maybe just defining the different types of housing, like the low income
Sure.
versus,
So,
for us, we're.
And maybe a little sense of history,
okay.
kind of how it's evolved over time.
So there's a huge problem that affordable housing, as with so many things inside of so many topics, affordable housing is a topic this big. And as soon as when people are talking about it, it's not unusual for people to be talking about individual slices and think they're talking about the same thing.
Right.
And they're not. And many of the issues, if you could picture from someone going from homeless up to somebody who has a fully functioning family and needs a slight discount on rent, are wildly different problems and wildly different issues. And the support network needed is wildly different. Inside of New Canaan, we currently essentially we end up having 213 units we'll break it down even further. We have 113 units over at Millport, and those are a combination of state median income, 60 to 80% state median income units. You have state median income and you have area median income.
Mhm.
State, not surprisingly, is much lower than area median income. And not surprisingly, it makes sense that in a community, in some place like Fairfield County and Lower Fairfield County in particular, costs of housing are much higher than, let's say, up in Canaan, Connecticut. And that creates some issues when the state mandates SMI versus AMI. So SMI tends to be almost half of what the AMI units are. And that creates a massive financing problem. There's periods when housing is an absolute home run, and there's periods when it's an absolute disaster. Most of the time, it's a meat and potatoes type investment where, a 5, 6, 7% return is really good. And so if you go ahead and start taking rents, and by the way, when you try to pencil out any sort of development, everyone's betting on appreciation in order to make the finances work. And here under affordable housing, you start out at such a deficit, it's not even funny. I mean, it's you're way in the hole in trying to make this work. As such, we've been lucky that at Canaan Parish and in Millport, we had 2 properties that were owned by the town that have been leased to the housing authority, and Canaan Parish was actually a joint venture between New Canaan Neighbors and the housing authority. New Canaan Neighbors was the original group that built those units.
Oh.
And then we partnered in order to redevelop. A lot of that deals with the bonding authority of the housing.
They did a beautiful job.
How many units at Canaan Parish?
Canaan Parish is 100 units, 60 of which are Section 8 project-based vouchers. So that project has 60 Section 8 units, which essentially means that we get paid market rent for those units. So each individual will pay 30% of their income, and the difference between 30% of their income and the market is paid by HUD.
Said a different way, it's a sliding scale, right? What percentage you're going to pay based on your, and then HUD Section 8 filling that gap in order to get them to a
So
market.
those units are economically imbalanced for us because we get the extra money from HUD?
And that's why, people say like Canaan Parish should be like the model for all affordable housing. You're like, well, it should be, but it won't be. I mean, there was a series of things that came together on that project that will never exist again, where, free land, the reality that we didn't have to really relocate tenants. We were able to keep most of the tenants on property, which is $1 million deal if we had to relocate them and then bring everybody back. It was bid out and contracted during low construction costs. We completed all of our financing when it was, I think we're at like 30-year money at sub 3.
Wow.
And then all the rents end up going up. So good luck anyway, make that work.
Is there a limit in terms of income to be in those?
So Section 8,
That's-
qualifying for Section 8 is you're very low income.
Uh-huh.
I don't even know what the numbers are. Unfortunately, people who get into Section 8 housing frequently stay there for a long time, if not forever. Some people really need it because without that, they would not actually have access toward housing. Others make that as a
I
choice.
have a stupid question about that.
So some of my clients, I know Section 8 is like, the problem also is in Connecticut, Section 8 is closed. Like even the wait list is closed because it's so packed. But if someone on Section 8 is on Section 8 and has children, and then that person passes away, does the Section 8 get inherited to that child? Is that how that works? Because like some of my clients, I'm not sure how.
There's a whole lot of so if let's say a parent was living with a
Yeah.
child in the apartment, when the child becomes 18, then they actually get added to the residence.
Oh, they do. Okay.
Now their income gets combined to see about the affordability of the unit. And as long as the income works, then they're both residents. And if one were to pass away, the other one gets to continue on.
Okay.
And so that's how sort of some Section 8 housing gets passed on to generally becomes.
Which also then makes it
generational asset.
difficult because like the new generations who need Section 8 aren't given the opportunity to even apply for the wait list because like these Section 8, it's almost like, I wish the Section 8 were more of like, you can be on Section 8 for 10 years kind of thing, like, and get your act together. You have 10 years to like sort of.
I mean, on the good side, sorry, so the rest of Canaan Parish, 40 of the units end up being 60 and 80%
Like
SMI.
Sorry, 68% what?
60 and 80% SMI.
Same as Millport.
Yeah.
Correct.
And that's. Yeah.
And then Millport also has a little bit of a RAD conversion. So some of the units at Millport were public housing, and public housing is like the worst of the things of all parts because either government ends up doing subsidized loans and ways to build construction, or they subsidize the rent. Public housing is, well, they give you a little bit of money up front and then you operate at a deficit and they kind of make up whatever the deficit is on the project. But to get the money is very hard to do, and the administrative burden is death. And so luckily we got rid of that, but we had to convert over in what's called a RAD conversion. The RAD conversion, those are lower they are much lower rents. And it's really kind of another financial strain on the Millport project because we have some very low rent folks there under a prior deal.
But there's no HUD subsidy there, no subsidy in those?
No, we get no income from any other source, except for we do have a couple Section 8 voucher holders who do have apartments there.
But the rents collectively don't cover the costs, is that accurate? In Millport?
This year, we made a profit.
Oh.
Sorry, a profit that's more than like a couple $1,000s.
Yeah.
So I mean, it's taken a long time and a lot of refinancing and doing a lot of work to get to the point where it's not, I mean, again, checking the couch cushions in order to figure out how to do repairs.
One of the points to Marcy's point though, which I think is a dynamic we all should be aware of. There are employers and employees in this community who, if they're on a Section 8 or they're on some type of subsidy, will cut their hours of working in order to not lose that subsidy. That is an issue. That is a problem. So when you're talking about trying to employ someone and bring their socioeconomic status higher, and they're working 40 hours a week making, and you are promoting them and they're going up, and now they're cutting their hours to 32 hours and they want to cut their hours to 24 hours. They're playing that game in order to not get off of that. So those are the types of things I just want everyone to know, he's simplifying it for us and I appreciate that, Scott, but this is a very complex socioeconomic position or economy, sub-economy that is happening, that is working the system.
So people are in either Millport or Canaan Parish, and somebody in the household suddenly gets a much better job. So God forbid, or they go to college.
So what you do have is that a huge problem, a massive problem is that you end up having, they set limits to get in. And the limits become absolute. So let's say it's $56,000. You can't make more than $56,100 to get in. If you make $56,101, you're not applicable, not allowed. Now, the other tricky part is you're going to give 30, essentially, the rents are set, and let's say it's about $1,600 for a 1-bedroom apartment. People have to decide whether or not, okay, in between those levels, who can actually afford to be there. And so we're trying to create these units that you need to make at least like $49,000 to live there and be able to function. But if you make more than 56, then you can't live there. So we've got this teeny little slice that we're trying to go ahead and address. And if it's too little, you can't afford it. If it's too much, you're not allowed. They do have one good thing is that once you're in, you can earn up to double of whatever the minimums are before you end up having to get out.
Okay.
So at least that part's good because again, otherwise you're like, well, why should I ever improve? Because I'm going to lose this $2,000 a month, a week, month subsidy.
Can I just interject for
Sure.
1 second? And just a quick comment because I want to focus on Scott and his knowledge. And whenever you have systems like this in place, of course, there are people who learn to game them. And that's incredibly frustrating, and I get it. But that is the minority of people. And I think that we tend to focus on that minority as if that's everybody. It's really important to remember that if your hours pop up so that you're no longer eligible for your housing, that doesn't mean that you can afford housing on your own at that new level. So someone might not be gaming the system as much as they're saying, I and my kids will not be able to live anywhere if I work this many hours and become ineligible for this housing. And especially in Connecticut, where housing is so incredibly problematic. And you cannot afford to live somewhere making minimum wage anywhere. And so I think it's really important. It's like we all keep saying, very complicated. There's so many layers. But I think that we often simplify it by saying, oh, well, all these people are gaming the system or the system is, screwed up this way. But it's just important to remember there are a lot of people caught in this situation and they don't have another choice. They're not trying to game.
They're making economically rational choices.
Right.
Where things become, and again, so the state has the 830G rule, which is that if we don't have 10% affordable, then basically developers can override all of our zoning codes. And people, when I first learned about this, I didn't believe it.
Mhm.
And then when I tell people about it, nobody believes it, that, the View could have been an 8-story tower with 20,000 square feet of retail in it.
Yeah.
And then it was like, that's impossible. And you're like, no, that's absolutely 100% well within the rules and acceptable. So it's a heck of I've referred to it as a bazooka, it's trying to solve a problem with the bazooka. And with the bazooka, there's a lot of collateral damage. But because they have put that out there as a relatively small community with, limited resources, it's like, okay, well, what are we going to focus on? So you got this whole stack, and at this little slice, there's a tremendous negative impact if we don't address that little slice. So we're focusing our resources on trying to go ahead and be 830G compliant in getting moratorium. So if you get about 1% affordable housing,
We
So-
have a moratorium in place now, right?
correct.
But we still have projects that happened before, were applied for before that might go forward?
Yes. So people got through a our moratorium dropped, and there's a series of reasons because of that, partly due to COVID, partly due to debt diet on the state, a whole bunch of things.
Mhm.
So there are some projects that are in the 830G process in New Canaan. We could, in theory, we could focus under, AMI is probably more applicable, the area median for New Canaan, where you find people again, where, okay, let's get our police officers, our fire
Right.
department, people who work at Waveney, our teachers, they would probably benefit from AMI.
Yeah.
But a question for New Canaan is, okay, if we are going to do serious additional density, and then, for example, in order to actually meet the 830G 10% rule, we essentially need to put 6 more of the View or Canaan Parish or Millport. 6 more of those.
Of those size,
Yeah.
that size of project.
Each of those is around 100. And you're like, that's a lot. And when you look where they can go in town, it's like, I know 2, 3, 4 places we could do some of them.
Mhm.
But again, when you get to that point, you're sitting there going, it's like, and by the way, that's if you did them all as affordable. If you did them 30 or 40% affordable, 60 to 70% market, then you're talking about having to do something like 13 or 14 of those. And I don't know how you do 13 or 14 of them.
Where would you do it?
And when you look toward New Canaan, all of a sudden you had 13 or 14, let's say it's 2,000 residents. Let's say now we got 500 more kids. We've got significantly more seniors. We got significantly more, people. We don't have the supermarkets.
Marcy in a pretty major way, I'm sure.
I mean, yeah,
All of our resources, right? That could be an issue.
Everything becomes taxed. I mean, that's a lot of people down in New Canaan. Darien is almost going to be an experiment where Darien, we met with the Housing Authority of Darien a couple of weeks ago, and they don't really have a strategy for 830G. They're not looking at it. They're not seeing it. Their inclusionary zoning refers to AMI instead of SMI. And we'll see how it goes. Nobody really knows how many units are being added to, nobody readily knows how many units are being added to Darien right now, but it's probably, 500 units inside of a 2.5 year
affordable?
period. No,
Oh, there's a lot of new development there, along the post road and down in the Road Heights, yeah.
and so we'll end up seeing, okay, well, if you add 500 or 600 units, and admittedly, they have the turnpike, you have the post road, you have different resources in Darien that we don't necessarily have. But that's a lot of people to add to a community in a very short period of time.
One of the questions we get asked a lot, I think misconception is that New Canaan, if you live in New Canaan, you're given a priority consideration for housing in one of these. And that's not true, correct? Is there a general application process that takes place for the entire state?
So there is the affordable housing is extremely regulated. And so like the whole concept of like, you're being able to like jump a waiting list is an impossibility. I mean, it's like we open up the waiting list, people can come in, you can get on the waiting list. I believe that we are allowed town employees, and we may be allowed something under residents in New Canaan, but it's not a huge jump. And it doesn't, for 1-bedroom apartments under the SMI, we have a reasonable turnover. So if somebody's looking for a 1-bedroom apartment, you can get that on a reasonable basis. A few months, sometimes it's open right away. 2 and 3 bedroom, it's a multi-year wait. So, they do not turn over. Once somebody gets in and gets access to the school system, they're going to stay and they're going to do what they need to do to stay, which again, makes total complete sense. And those units do not turn over. So even with any sort of a priority, you're still years before you would even come up. And again, it goes on the wait list. And this is one of the things that makes affordable housing even more expensive to run, is that if we have a vacancy, we need to go to the wait list. The wait list may have people on it that have been on it for 2 years, 3 years, 4 years. We have to make an effort to contact them and document them on the contacting. So you go to the first 10 people. It takes about a month in order to find out. Some people are making more money. Other people have leases that they've signed, that they just signed, that they can't get out of. You can't do whatever. Things change. So whenever their income level is up or down, whatever it is. And so it's like, okay, those 10 don't work. Go to the next 10. And it might take 3 or 4 months to go to find someone who's still from the wait list, who's still interested in the apartment. And meanwhile, there's no rent coming in. And so it's just we know why the system's there, because there's humans involved. And if you don't have the system, boy, what could go wrong? Well, we all know what could go wrong. However, it does make it very cumbersome in order to actually work this process.
Can I ask one more question? Not to put you on the hot
Yes,
seat, but these are all questions like my clients will ask me and I sometimes don't really know the answers. So the affordable, considered the affordable, is the limit or income necessity is like 67,000 to 72 or something like that. So the problem is that AMI or SMI? Because 67, yes, is like a decent income, but it's too low for like town employees. They're making too much, but they're not making enough to live here or even around here. So say they're making like 80, but like rent is like $4,000 a month for like, a 2-bedroom someplace. So like, is that AMI or SMI for like affordable housing?
So it changes every year,
Okay.
and I gave up keeping track a long time ago because I
Okay.
just don't hit it all.
Yeah.
And then it depends on the 60 and the 80%. And so again, we get more benefit by doing 60% for 830G. So we have more 60, we've got a bunch of 60%. The 80% end up serving again, almost a different strata of the ecosphere.
Right.
And it also ends up providing a little bit more rent. You're in that close range. If you do, I'm sure we could go to Gemini or something right now, and it would tell us, roughly what those rates are in Connecticut. But it has to be checked each year and seeing when it comes to it. But that's roughly the zone. I think it's a little bit less for single, and I think that's probably for like a 2-bedroom.
Yeah.
That might be that range.
How about the Avalon?
I was just gonna ask that too. yeah.
Avalon, no
Riverwood.
longer called Avalon, but that
Riverwood.
Riverwood. Riverwood. Yeah.
That was a real coup for
That-
you to make that happen.
That was a big,
Almost
and you were heroic, I know that.
almost killed me.
Almost have to color your hair now and everything, but is that, how many affordable units are we going to be getting from that?
So there's 104 units at Avalon. Yeah.
It seems so big.
Some of them are kind of big units.
Well, some of it is also you look toward, and this is one of those issues like Canaan Parish versus Millport and Avalon. A reason, we could have gone ahead and spread out and done townhouses or something else. It would have covered the entire site. There'd be no green space there. We could have done 3 stories. It would have covered almost the entire site. So by getting the permission from P&Z to go ahead and do 4 stories, we were able to have more green space and make what we believe
This
is
is
a
at
much
Canaan
better
Parish
product.
you're talking about.
Correct. And Millport Avalon ends up being townhouses, and townhouses are very space intensive. I mean, really space intensive. And so you 104 units spreads out over a bigger space versus putting like the Canaan
Sure.
Parish where it goes smaller. So we got something called a Fannie Mae essential housing bond to finance this 65% of the purchase. It started at 75% of the purchase, and then they kept whittling us down. That requires us to have 20% at 80% AMI within a year. So we'll end up having 21 80% AMI units at Avalon by the end of this year. The requirement is that they are the rent level, not the individual, which makes it much easier to fill them because, you know, again, trying to find these people that want to live here, that can afford to pay this, that want to do something else is brutal. So we'll end up so instead we only have to have the rents at those levels, no matter who's in them.
That
Now,
counts, somebody with a $500,000 income?
now the reality of this is that Avalon is a defensive play. In order to do affordable housing, you need time, you need density, and you need money. Avalon is already built. It's already a dense space in town. And so all we had to deal with was just that little nagging thing called money. So we are currently short in the neighborhood of 20 units for our next moratorium, which we're about 3 years away from that. So a purpose under Avalon is that any developer out there that's thinking of doing an 830G in New Canaan can look out and say, it's like, they're gonna get the next moratorium. So it's, you know, we have a stock of units that we can convert to SMI and get the number of units we need for a moratorium. So it discourages a developer from going ahead and planning a project because it's gonna have to wait out another 4 years in order to do the project. It then is also, we can actually trigger and get more affordable housing there to get our next moratorium. That's going to be expensive. Avalon, the Riverwood is, I mean, it took a lot to get this deal done and we're heavily leveraged. And to convert from market rate of say 5,000 to 80%. So as an example, and I'm gonna be off, but I'm directionally correct here. Market rate at 5,200 for a unit. AMI is like 4,200 for a unit. SMI is like 2,200 for a unit. So that $3,000 a month per apartment, when you recapitalize that and put it back into a sort of a cap rate, you're talking in the neighborhood like $400,000 to $500,000 per unit to convert over to SMI. And that really has to come from the town. I mean, Housing Authority will make some money and make this happen, but otherwise that's it. I mean, ironically, when the idea first came up, Deanna and Steve said, you know, let's see what we can do about this. I said, great, just give me 20 million bucks, I'll make it happen. And it turns out, well, to get them as SMI, you need about, I said, it's not quite that bad, but I mean, about 10 to 12 million bucks in order to make the conversion.
But your planning is people move out at this point to try and convert them then to affordable.
As because the project is leveraged such as it is,
Yeah.
we want to keep it market rate as long as we can keep
Okay.
it market rate. And in addition, there's going to be some more affordable units that come online before that time. So we don't know if we need to convert 21 units, 15 units, 8 units, 5 units. Whatever it is, we're going to try to convert as few as possible. Because again, this was a really leveraged deal. And there was very little town money that went into this. Very little.
Really appreciate how you made all that happen.
It seems to me that the potential ripple effects, right, on the departments we support are probably the biggest concern for us. Is there any modeling, forecasting, or anything along those lines that is being done or being considered as these units increase in town, and whether it's for the school system or for the health department?
We did do modeling for Canaan Parish, and I think like under Canaan Parish, I mean, it was something like 30 school kids. I mean, that's the difference under the renovation. We only added 40 units, and of the 40 units, half of them were multi-bedroom. And so it was not adding a whole lot. Under Avalon, again, we're probably, we'll have 20 some odd units that'll be affordable over the next, 7 years.
Yeah.
At 7 years, maybe we end up having a whole another 50 or 60. So if we're following a moratorium, plan, it's like call it 65 units every 4 years.
Yeah.
And out of that 65,
Maybe half have
maybe
kids.
20 to 25 would have kids,
Yeah.
something like that.
But it's
Probably-
compounding, but it's compounding.
That
Right,
Right.
but also spread across different grades, so you're not necessarily
That's correct.
flooding in and
The kindergarten or
we're in the
something.
kindergarten or
Yeah,
something.
right.
So I mean, you're looking, and again, it will be stacked, but I mean, essentially you're saying 5 or 6 kids a year. But the reality is going to be in a lump of 25 because a project will come due. Although, again, there's a possibility that we're able to do some smaller projects or other developers will be doing that. So the impact will be slow moving. And again, I think while everyone would love to have affordable housing for everyone, everyone in the building trades aren't going to work for free. We're not going to get any building materials for free. And again, the development process is expensive under the private side. The development on the affordable side is unbelievably expensive.
Yeah.
It's just they add so many more layers and so much red tape that it becomes the most expensive type of.
And I have a question that maybe is kind of, if you're adding more units isn't there like a percentage of your town that has to be affordable housing? Is that how it works? I'm just saying, if you add 100 units, and are you adding, the number of houses in the town goes up, and then does that mean your number of affordable units you have to have goes up?
Correct. So in New Canaan, we've implemented an inclusionary zoning rule. So if you're doing, I think it's 15% of units. So if you build 100 units, again, math isn't exactly right on this, but we do simplified math. You built 100 units, 15 of those units need to be affordable. And so toward our 10% goal, we're making progress. Not a lot of progress, but we are making progress. And that again gets to one of the, and by the way, you have House Bill 5002, which passed through the House and the Senate, and Lamont may very well sign it. And it is a gigantic step toward fair share housing, which means we've got to get up to 30%. So if that goes in, and by the way, it's all voluntary. Yeah, right. I mean, New Canaan doesn't get a lot of money from the state anyway, but we'll lose like all of other funding under this, and it's going to be a complete, utter disaster. And a lot of stuff inside of the bill, you can't require parking for under 24 units of development. Can't require any on-site parking.
Well, the other piece is if the town owns it, it's permanent.
Correct.
Right? If a developer builds it, then it expires at a period of time. So look, it is a very complex issue. Affordable housing is needed, no question, for so many people throughout. And there's not that many multifamily complexes that are out there that the town can go and now acquire. We're gonna have to continue to look at it. There is, if you have a percentage, a new developer, there's a percentage of density that can increase for that site in terms of the number of units that you can build on it in order to add that. But again, as a developer, that expires at a period of time. And so owning by the town means that it's permanent. It's permanent on that list. So.
My question is there some sort of revolutionary technology for building that costs a lot less than the current technology? In other words, why does a house have to cost so much? Is there a?
Whoa.
That cuts at their business, but.
Well, I mean, there's a couple of things to that. I mean, one, there is some other technologies that are coming along, but in a way, it's like, why does a car cost so much today? And part of the reason the car costs so much today is because you have front airbag, passenger airbag, side airbags. All of a sudden you add the cameras, you add a whole bunch of other stuff that any individual part of that doesn't add a whole bunch to the car. But by the time you're done, you're like, wait, the car's now 20,000. Every car is $20,000 more.
Wheels, right?
And housing's a similar thing. So let's say like fire safety code. And it's like, everyone wants to make sure their houses are safe for fire stuff. Well, the people who write the code end up being the fire marshals, who the sprinkler companies pay for their convention. And they go out there and they determine, it's like, well, should we do a little bit of added sprinklers in order to make sure people don't burn to death? Yeah, I think that's a good idea. Okay, well, do you just added $2,000 per unit to everything that happens, whether it's needed or not? And that happens across, I walked into a house that we were building up on, right on the Hudson. And as I walked through the house, I'm looking at the structure in this thing. And you're going, I mean, this is insane. I mean, we have tie downs, there's all these metal banding, Simpson strong tie things that just across the board, unbelievably, it's just ridiculous. And it's like, well, this is hurricane, we're in a hurricane zone. You got to make this so the house doesn't blow away. It's like, we tore down a 200-year-old house on this site. Somehow for 200 years, the two nails that held the joist together was fine. Now we need a joist hanger that's got 18 nails going around it and specialized other stuff. And you're like going, this is insane. And that's a lot of the codes push under that and they push under it. In addition, under affordable housing, if you end up taking, depending upon the money that you take in order to do the housing, you might be bound by Davis-Bacon rules, which means you have to pay prevailing wage, which means you have to do union.
Was
which means
prevailing
that
wage
most of
used,
it-
was that part of Canaan Parish construction?
I don't think that for a lot of it, it was not. For Millport, it was. Millport, it was everywhere. And then essentially, it's like most of the money that you get gets turned around and given to the unions.
A lot has to do with how it's financed as well.
Yeah.
And then you-
Financing does require prevailing wage.
And then you get certain other codes as to the size of the units. I mean, for example, in Canaan Parish, most of the units are now almost twice as big as they were before. And again, when you walked into the original Canaan Parish units, you're like, it was like 400 feet. It was tight. And now they're around 650 to 700, 650 to 725 or something for a one bedroom, which is much more, I mean, it's not
Livable.
extravagant,
No.
Right.
but it's much more livable under modern standards.
Mm.
So, and then by the way, everything has air conditioning now and,
Yeah.
you know, you want to do more glass. And by the way, the glass has to be efficient. And then there's a whole lot of stuff that it just rolls up.
You hit a good nerve.
Yeah, so I think, I know where Mom would be conscious of your time. It's just maybe one more question or you've answered them all.
I would say, I mean, if you, for following like affordable housing issues or in general, I mean, Maria Weingart under CT 169 strong is really important to kind of follow. There's also, I don't know if you guys, anyone's ever heard of the Strong Towns movement, where
No.
the Strong Towns, they have a podcast that's called Strong Towns. And it just talks about different ways of thinking about issues and problems and how to make towns more livable and affordable. And I disagree with some of their things, but they have a lot of great thought process to just, how can we make a community stronger and better? Some of which deals with housing. But under both of those, getting more vouchers is really the only way to help more people. You know, trying to build these units and then manage and run them is tough. And
Right.
I pointed out to Deanna that, you know, at some point, and we're not very far away from that, you know, we can't have a volunteer housing authority. I mean, this, you know, we're stretched,
Right.
really stretched on this. And we have professional help actually managing the process, but just the board managing it. I mean, we got $150 million worth of assets. I mean, it's a big deal, and we're doing this kind of on the cheap on the side. And so the town, in addition, we kind of need to get a housing authority, and we're not ready for it yet.
Mhm.
But if we do one more, we got to layer on a whole nother layer of management.
Well, we really appreciate you and your team, everything that you do.
Can I ask one
Right.
other question? I'm sorry, I feel like we're bringing it way back again, but I'll just kick myself if I don't ask this.
Sure.
I'm just trying to have a really solid understanding of how much of what we're doing right now, kind of like what we have in the works, is affordable versus subsidized. If that makes sense. So Section 8 versus, and the reason why I ask this is I feel like we talk a lot about, you know, forecasting
The caseload.
the caseload, and I think with schools, that's, you know, that's different. But, you know, if you're, you know, a teacher and a family and you move into town with affordable housing, chances are you're not going to be using a lot of health and human services. But then that sounds like that's more expensive and harder for us to provide. And then you've got the, you know, Section 8 housing, where I feel like that's where we really would need to look at use of health and human services, but maybe that's more affordable for us on the housing side because it gets reimbursed, but.
Well, I'd say that that's a fair assessment.
Yeah.
I would say that for like housing authority, one of the things that would be very helpful, and by the way, with New Canaan Neighbors, who is our partner at Canaan Parish, I mean, they actually are almost kind of a new charity. I mean, they have a slug of money and they're figuring out exactly what they want to do and how to use it. But like, we face situations all the time where we've got somebody who, you know, if you have that job interruption, and, you know, like for $1,000 or $2,000, you stay housed.
Yeah.
we can't treat anyone special, because if we go ahead and say, well, you don't have to pay the 1,000, then that means nobody has to pay 1,000. And then you're like going, you people are killing us. You're just killing us here. We can't try to do the right thing. So there's people, again, that for small amounts of money, the difference between housed and unhoused. And again, the car breaks down, as you talk about, the medical thing, something goes on. And that's something that even on the affordable, not the subsidized side, that still makes a big difference for a lot of people.
I actually noticed the affordable is actually sort of harder, because say you're just making 70, but you qualify for this affordable housing, $1,600 and 70 is your gross, $1,600 is a lot. And then we actually, human services tend to help more the affordable housing people, because it is so much more expensive
Right,
Yeah.
right.
to live here
Mhm.
at that rate.
And I guess that I keep like trying to press on this
Yeah.
as well to get an understanding. I'm just surprised how many people I talk to just in my social life who are literally concerned about safety issues with affordable housing. And I know, and I don't feel, I have a gut reaction, but I feel like that's not fair. I need to understand really what the numbers are, because again, very different than I think that they're thinking about, like a Hollywood representation of subsidized housing and public housing. And so I know that we do have some families in town, and they struggle with all sorts of different issues based off of their socioeconomic situation. But that is, to me, and maybe I'm wrong, a tiny minority. A lot of what we're talking about with affordable housing, the issues are what you've been talking about. It's a huge financial burden on our town, but not necessarily bringing in crime and drug dealing and,
To be in affordable, to be in SMI, AMI units, you're at the very high end of the affordable housing spectrum.
Yeah.
I mean, you gotta have a job, you gotta have the source of income, you gotta be able to figure out how to get to your job. All of those things that at the very low end are questionable. At the higher end, it's much better. Actually had one of our superintendents out in the Hamptons got into a real serious fight out there with what turned out to be a bunch of extremely affluent kids. And you're sitting there going, there's no money issues involved under that. Actually, there are, it's just on the other end of the spectrum. And so I would say, we probably have a higher level of incidents and issues, but a chunk of that is due to the fact that we got a lot of people living together. And then again, you got an 80-20, it's not even probably 80-20, it's probably 95-5. When you got a 5% that it's like, they're cheating the system, they're not great under this, they detract from everybody else inside of the system. And meanwhile, the vast majority of the folks are really good, hardworking folks that are making sacrifices for the good of their family.
Yeah, that's important to try and communicate, I
Good
think.
point.
Yeah, very important.
And I will say the couple bad ones though.
Yeah. No.
But I think every landlord ever has said that.
Yeah, that's true.
But I would say that about, exactly, every single
Correct.
Apartment building. yeah.
piece of the spectrum as well.
But if you're are we taking into account all the accessory structures too of these little 1-bedroom studios, or is it just like so minute that it's just like point, like I mean,
So affordable housing
yeah.
is defined as legally deeded for at least 40 years to be affordable.
Okay.
So this gets to the point where the whole idea of like auxiliary
Yeah,
units
yeah.
is a great idea. And it'd be great if we have, and again, it should be, I believe it should be under special permit and granted frequently.
Yeah.
Because we all know there's certain places you're going, well, that doesn't make any sense. And so if we can prevent the not making sense, it should happen a lot. However, to get them to count toward affordable, toward 830G, you as a property owner would have to say, I am going to go ahead and deed this officially as affordable. And I'm going to submit myself to all of the rules under affordable, including going ahead and submitting all of the paperwork and vetting of the people and running a wait list. And it's like, no sane person would ever say that I'm going to put my auxiliary apartment as an affordable unit.
Yeah.
Which is, and again, the 830G has no concern over what rents are, only if it's deeded affordable. So if the whole town had rents at,
It seems like we would
it would,
Not meet it, but be a little closer.
right, we would.
Yeah.
But their response is then, well, we ought to put the limit up to like 30 or 40%. And you're like,
Okay.
you guys are killing us, man. You're just
And
killing
you're
us.
not getting paid, right?
Right.
To do this.
Oh, he's
There's
getting
no-
paid, it's not money.
Well, we really.
Thank you
we really
again.
appreciate, yeah.
Thank you, guys.
Thank
Again,
you
nice job.
so much. Thank you.
Thank you.
That's so helpful.
Yeah, it's really, it answers a lot of our questions.
Yes.
And I'm around and
So
as
complicated.
I point out with affordable housing, you'll sit on a lot of this and go, wait, is that kind of what hold on a second.
Yeah.
That can't be right. And I'm happy to, answer any other questions.
Well, thank you, yeah.
Thank you so much.
Yes,
Thank
it's a
you.
lot of information. Thank you so much. It was really great.
I just don't, I mean, it's such a complex,
Yeah.
it's so full
Yeah.
of so many issues
Just-
and backwards things, and it's just frustrating.
Yeah. No. I agree.
Well,
This is-
before I make the motion to adjourn, I know everyone's looking at me to do that. I think it would behoove us, I think, to help dispel some of the issues that Jen brought up. If we had a way to garner the stats, and I don't know how better to do that, to see what the impact is on our EMS team, our police force or whatever. We think that they have extrapolated out to see what the impact on the school is. We're truly going to plan ahead.
Mhm.
And as more and more become affordable or workforce housing, whatever term we want to put on it, is that 5% or 10%, what that impact is. I mean, because my biggest concern is when we talk about energy assistance, okay, what was signed yesterday may save $100 a year. $100 a year is not enough for someone who is struggling and trying to get their family and move up in the system. That's nothing. So the amount of money we're spending on energy assistance, I think, is just going to continue to go up. So if we can, as a group, somehow forecast but get the data from someone
Yeah,
who
I'm not
we
sure
ask
where
for
you get the
that.
data, yeah, because a
Um,
lot of it's confidential, I'm sure.
It is confidential, but
Mhm.
the same thing with domestic violence. When we look at
Mhm.
again, I personally think, and I think most of us share the same common mission. We're trying to go upstream as much as we can and look at preventive measures and
Mhm.
things of that nature. And then downstream, looking at what the impact's going to be on the departments that report to us, both financially as well as time.
Right,
So-
no, it's a good point, yeah. I know, Marcy, you have some money in a budget if you needed to hire an additional person, right? And that very well could help inform that.
Yeah, I just think it helps justify it.
Yeah, absolutely.
When they go to make the pitch, we have the data available.
It's almost like programming around energy saving. Like, what does that actually look like? And, anything kind of.
Yeah.
Thinking forward to as the density increases.
Well, that's like, I think, I know that everyone wants to go home, so, but Catholic Charities, who comes in and does our budgeting, she is booked until like the end of July. And I think that's because like the affordable housing, again, is section 8 is 30%. Affordable housing is what it is. So it's $1,600 a month for one bedroom, and then it goes up from there. So if you're making just 70,000 and you gotta figure out how to make your car repairs, and 70,000 again, after taxes is what, like
50
52 or
maybe,
something?
yeah.
And you're spending almost $2,000 a month in rent and utilities.
Half of your income, yeah.
It's like,
There's
that's
no
why.
room. There's no room.
There's no room.
Yeah.
And that's what it's like, you almost wish that like, I know, it's like the affordable housing threshold is too low for our like blue collar,
Right.
or people working at the restaurants and stuff, like it's too high for their income. It's too low for teachers and police to live there. It's like it's a bad threshold, and there's nothing. we
The
can really
last,
do
the
about
last
it.
part, if we do not allow HUD to expand
Right.
and people are caught into that, as he caught into that slice or that vortex, and we're taking people off of Medicaid,
Right.
the economic pressure
Right.
on this small group has to give somewhere. And it's going to give, I think, in, mental health issues, stress related issues, domestic violence
Right.
issues. It's got to give, that pressure cooker
Mhm.
has to give off somewhere.
That's a good point.
And I think we just need to be aware of that and acknowledge that what that may be coming down the road and trying to forecast where we can and try to get upstream. But these are three major impacts coming down on our community that are, it's not going to be a ripple effect, it's going to be a tsunami,
Mm.
right? So,
I feel like COVID. I feel like
Yeah,
COVID on
exactly.
steroids, you know?
exactly is. So, motion to adjourn, I know I'm known for it. So, but I thank everybody. I mean, the last couple of meetings have been extraordinarily dynamic and, very.
Well, and the timing is really good
When
for
is
you
our
all.
next meeting?
It's not till September,
Oh, okay.
what is it?
You have a long time to think about these conversations.
But also, I think your commission, I mean, your committee that's going to talk about what our priorities are.
Sure.
You can synthesize some of that and that may be really helpful to us.
It's
will be
picking the
really
top
helpful.
three, that's always
I
the
think that's
fun
pretty
part,
easy,
right?
yeah.
What
But no,
what they are and how we can move the needle. So motion to adjourn,
second, all in
third.
favor?
and thank you for the minutes, they've been great.
Yes,
Thank
they
you,
have.
Jen.
Okay, good.
I just want you can't talk because you're so busy typing.
I know, but like I stopped during Scott's because I thought, you know what? I'll go back and watch the video.
Oh, yeah.